You have in pharmacology 5 units. They have been subdivided into 2 branches. The first branch or the division deals with the general pharmacology, starting from what is a drug, what is a dose, how the drug acts, the mechanism of drug action or pharmacodynamics, then what the body is doing to a drug, that is pharmacokinetics, including absorption, distribution, metabolism, and elimination of drug. When you want to use the word excretion, it is simple. When you use the word elimination, which will combinedly mean the 2 processes of liver done work, the work done by liver called as metabolism, and then the work being done by the kidneys, excretion, both combinedly as elimination. Apart from that, side effects, untoward effects, idiosyncrasy, allergy, mechanism of drug action, different types of receptors and their location and chemical nature and drug action, then structure-activity relationship, the structure of drugs and their actions. All these things are being covered. Route of administration, pathology, pathological process, disease mechanism, inflammation, all these things will come under general pharmacology. After studying the basic, we have been provided with 2 units highly dedicated to drugs acting on nervous system. Drugs acting on the nervous system, in which this time you will have drugs acting on both the nervous system, both the nervous systems. So before teaching about basics of nervous system, and so no teacher is required for you to study this autonomic nervous system and central nervous system drug action. You have to go through the book for classification. And another, you may be having nearly 10 to 15 classes or 10 to 12 classes. Before that, you have to cover all these portions. We'll have classification of drugs, and main 1 or 2 drugs you have to take from every chapter, and you have to go for all the relevant activities such as pharmacological action, mechanism of action, side effect, drug interaction, dosage. Clear? For any 1 or 2 important drug of every chapter or the classification. So before introducing the autonomic nervous system or peripheral nervous system, under which the autonomic nervous system falls, and the central nervous system, what are all the chapters you have? What are all the individual unit or individual portion you have in drugs acting on, or in the portion drugs acting on peripheral nervous system and central nervous system? So your teacher has covered around 3 units, and you will have now very good basic knowledge of general pharmacology and nervous system. Can you answer 1 or 2 questions of mine? You are all very aware of the fact that our body is organized into several systems. Every system has several organs, and every organ has its own tissues, group of tissues and then the cells. So every system has a specialized function. All the individual organs of the system will combinedly function together to complete an assignment, a physiological assignment. Likewise, one of the important systems in our body is nervous system. How will you basically, nervous system is organized as one member. It cannot be classified further. But for our understanding and easy understanding and subject understanding, we are dividing nervous system into 2 parts. What are they? Can you tell me? What are the basic units of nervous system? Now note down the question. Note down the questions first, then I will ask one by one. If you are not able to answer, I will give you the basic. Your teacher should have given the explanation, or you should have been given that explanation. If not, I will explain at least now, so that when you go through the book, it will be easy for you to follow. You understand? You have a follow-up, you must have the basic knowledge. So how will you classify nervous system? What are the two different types of nervous system in our body? And then, what is a neuron? And what is a neuroglia? And then, what are the parts of a neuron? And when two neurons are connected together, how will you name the parts where particularly a drug is going to act? And how you are going to conveniently understand about the division of nervous system, such as peripheral nervous system. Under peripheral nervous system, where the autonomic nervous system comes in. In the central nervous system, what are the drugs acting? And in the peripheral nervous system, what are the drugs acting? So if you take peripheral nervous system, probably you will come across autonomic nervous system. Apart from that, myasthenia gravis, a motor nervous system related, and then you will come across something like local anesthetics. This will be the units. When you come to the central nervous system, all the diseases related to central nervous system will be covered in your syllabus, such as general anesthesia, sedative, hypnotics, and convulsant, anticonvulsant drugs. So antipsychotic drug, under psychotic, schizophrenia and mania, schizophrenia and maniac diseases. Then different types of epilepsy or convulsions or fits. In common English we call it as fits. And what are the drugs? Then analgesic and inflammatory. These all will come under nervous system, local inflammation, and central nervous system related. See, in case of peripheral nervous system, the very important unit you will be studying is local anesthetic. Number 1, creating loss of sensation for the pain at a local site is local anesthetics. Right? You might have heard the word, very common drug, lignocaine, otherwise called as lidocaine. Right? Likewise is xylocaine. These names you may have heard. All are local anesthetic to create loss of pain at the local area, in the local site, given local site, for surgery or a temporary removal of pain. You understand? So before that, you should have a basic knowledge of nervous system. How will you divide nervous system? We can broadly classify nervous system into 2 categories. One is the central nervous system, other one is the peripheral nervous system. Central nervous system and peripheral nervous system. Take down a note and note down the terms. Take down the note and note down the terms. These terms must be thorough for you when I come for the next class. If you are not able to understand, you can ask me. I will give you the explanation, right explanation. So that when I go through the very basics and foundation of autonomic nervous system and drugs acting on autonomic nervous system, when I use the word sympathetic nervous system, parasympathetic nervous system, or cholinergic nervous system, adrenergic nervous system, adrenergic blocker, cholinergic blocker, cholinomimetic drug, adrenomimetic drug, sympathomimetic drug, and parasympathomimetic drug, sympatholytic drug, parasympatholytic drug. When I use all these terms, you must be very thorough where the drug acts, When you take one example of drug, there will be difference in their structure, in their organization, in their site of action, in their dose form and dosage form. That will be the difference, and side effects. This will be the difference. But if you look at the mechanism of action, most of the drugs will act on the same site, or more or less closely related sites, and exert its action. Right? So you must come across several pharmacological and physiological technical terms called as terminology. So note down the terms. So next class when I come on Monday I have my own hour, second hour, director hour. I will come and ask. When the student comes late, you tell the latecomers to read these terms and come for the next class. Okay? Number 1, neuron. Number 2, neuroglia, neuroglia, okay, neuroglia, GLA, right? GLIA, neuroglia, right? Neuron, neuroglia. Two types of nervous system. Two types of nervous system. Central nervous system, down. Peripheral nervous system, down. Autonomic nervous system, down. Motor nerves, down. Afferent nerves, down. Efferent nerves, down. Somatic nerves, down. Neurotransmitters, excitatory transmitter, excitatory transmitter, excitatory transmitter, inhibitory transmitters, epinephrine, acetylcholine, epinephrine or adrenaline, noradrenaline, acetylcholine, dopamine. Neurohormones, neurohormones, hormones versus enzymes, neurohormones versus neurotransmitters. Presynaptic fiber, postsynaptic fiber, synapse, synapse. In plural, synapses, synapse, synapses. Receptor, ganglion, ganglion, ganglion. Preganglionic fiber, postganglionic fiber, postganglionic end. Synapse, already written. Synaptic vesicle, synaptic vesicles. Axon, myelinated fiber, myelinated neurons, myelinated neurons. Dendrites, 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 dendrites. Polarization, depolarization. Membrane stabilizing effect, membrane stabilizing effect. Action potential, action potential. Polarized state, polarized state. Depolarized state, repolarization, repolarization. Refractory period, refractory period. Alpha beta receptors, nicotinic muscarinic receptors, alpha beta receptors, nicotinic and muscarinic receptors, nicotinic and muscarinic receptors. Gray matter, white matter of central nervous system. Gray matter and white matter of central nervous system. So these are the foundation for the central nervous system and autonomic nervous system and drugs acting on the nervous system.